The other thing, and by the way, our governor's name is Toby.
He's Irish.
The other thing that our governor has done is to create a payment model. Instead of paying for services provided,
Jacque
we are now
Martin.
going to pay per episodic health care visits. And I was talking to my primary physician one day about it, and he's going to tell me that
2440 Q&A.
$2 a head for any Medicaid patient, and if they don't get better, he has to return the $2 fee plus pay a fine to the state government. So how does that all fit into OB's scheme of things?
Well, different healthcare providers have different. They prefer. Well, they tend to prefer a fee-for-service payment model where they get paid an initial fee for every service, and there's less risk for them in that model. I sort of see different payment schemes, different ways of paying providers, as a choice between Hyundai or Lexus or some hybrid of something in between. Different payment systems work better for different people. Some people like their doctors to have. I'll just leave it at that. They work. I don't really see a problem with one or the other. What I have a problem with is the government trying to pick one for everybody, which is what the Medicaid program already does. And your doctor might like this other one less, but that's not necessarily. I mean, that doesn't mean that payment system is bad. It just means he doesn't like it. And the government shouldn't be picking one for everybody. One of the reasons why healthcare is so expensive is because the government does pick a winner in the marketplace, which is fee for service, and blocks competition from those other ways of paying for things. If they provide value, then they should be able to be out there in the market and meet people's needs. So, where I think it becomes a problem is what you're describing is kind of essentially the payment system that they use when they move Medicaid patients into managed care. They give them, instead of paying a fee to providers for every individual service, they pay a fee to a Medicaid managed care plan for each patient. They might do that, or they might pay the providers by salary, or they can do fee for service. It's not fee for episode of care. But the real danger is that when you switch from the existing Medicaid program, which is fee for service, to Medicaid managed care, and you're giving insurance companies is one fee per Medicaid enrollee, they're going to go out and find and bring out of the woodwork all sorts of people who cost much less than that fee, but who aren't costing the government anything because they're not enrolled in Medicaid, they're healthy. But every one of those people they find that cost less than that fee and they enroll, they get to keep the difference, between the healthcare that those people are using, the fee they collect from the government. And so what ends up happening is you expand the Medicaid rolls, so you make more people dependent on government for their healthcare, and you increase Medicaid spending. So that's a concern there, but I have much less of a problem with moving an existing population into a managed care model than I have with expanding Medicaid to new populations who aren't insured. Yes.
What is your recommendation for the answer?
For the answer, you mean once we get rid of Obamacare?
Well, in other words, what would you propose as a system? Yes, if you had anything you could do either in Arkansas or nationwide, what would be your recommendation?
Most of the obstacles to affordable quality health care in the United States come from Congress, and only Congress can fix those problems. There are some obstacles that states put in the way of market forces, making health care better and more affordable and bringing it within the reach of people who can't afford it today. And those are mostly have to do with the licensing of health insurance, licensing of providers, and medical malpractice liability.
Which is what we need.
So I think you need to reform all those three. I would say get rid of the first two because they don't help. Now, getting rid of licensing, that's kind of a tough sell. I understand that. But there are small steps you can take in that direction. Tennessee, Illinois, and Connecticut have gotten rid of the really ridiculous restrictions that exist in almost every other state that prevent doctors licensed by other states from coming into the state and giving away free medical care to people. There's a group called Remote Area Medical that does that. It's doctors from around the country to go into underserved areas and rural areas and inner cities, give away free medical care to people, but they've been turned away by states that say, no, your doctors aren't licensed here, turned away from giving free health care to the poor. So if you enact a law like that in Arkansas, then you'll be creating an opportunity for doctors to give away free health care to the poor, who cannot now. You'll be expanding access to health care for the poor, and it won't cost the state a thing. I'd also want to reform medical malpractice liability in the state, not by having the government decide what the rules are going to be, but by letting people write the reforms into the contract with their doctor and having courts enforce them. So if you like loser pays, if you like caps on damages, put that into the contract. If it brings down the cost of your care, great, and more people can afford care that way. But if you want the unlimited right to sue, you can pay for that too.